Very good morning, student. Okay, in the series of these introductory videos where I am trying to train you for the osteological classes, how you should, say when you will go to the osteological demonstration classes, then you should be ready for the bone classes. Okay, so today I am going to tell you about how, learn to identify the bone markings. Learn to identify the bone marking on the surface of the dry bone. That means when you will be handling these dry bones in your osteological classes, then you will see that the bone on the surface of the dry bone, there are many markings are there. There are some smooth area, there are some elevations are there, and there are some depression, foraminas are there seen here on the surface of the bone. All these features, they are called as the general features of a bone, dry bone, and these features, okay, or markings are because of the structures in relation to the bone when a person is alive, that means on a living bone. For example, the blood vessels, the nerve which comes in contact with the bony surface may form a shallow groove. In the similar way, okay, there may be the markings of the attachment of the ligaments, there may be the markings of attachment of the muscles which is taking origin, or the markings, elevated markings for the attachment of a tendon of a muscle. Okay, so there will be the many types of the markings, and this is in relation to the soft tissue which are in relation during the living conditions. Okay, so today I will teach you which are these markings, okay, on the surface of the dry bone and what names these markings are given. Very broadly speaking, the bony features are these markings of the bones we may classify into three different categories. For example, there may be marking which are smooth on the surface of the bone. You may get the smooth area. Okay. Then there may be markings where there is elevations or okay, the upward projections from the surface of the bone, which are called as in the second category as surface elevations. Then there will be the markings, okay, which are the surface depression. Okay, that means from the surface there may be depression on the surface of the bones may be there, okay, in the various form. Elevations are also in the various form. Similarly, the surface depressions on the surface of the bone, they are in the various form. So in these three different categories, we will see which are those bony markings are there, and they are given a special name. They are given, and I will try to explain you these different bony markings, because unless and until you will not learn these bony markings, you will not be able to understand what your teacher will teach you on a particular bone when your osteology demonstration will start. Okay, demonstration. So let us come to the first category, and this first category is the smooth area on the surface of the bone. So we will see first which are the smooth area on the surface of the bone. For example, this is a dry bone which will show the various kind of marking on the surface. But if you see the smooth area, this is a smooth area which is the area covering to the head, Then on the lower end of this femur bone, there is a large area here also, okay, which is covered by the smooth surface. It is the smooth surface. Then there may be the smooth surface which may be seen on the other areas also. For example, there is a smooth area here. This is the scapula. A small smooth area is seen here. Then a smooth area is seen here. And then let me search the bone where you can see the other smooth areas. Okay, there may be the smooth areas. See, for example, this small smooth area is here. Then if you see a vertebra there will be the smooth area is here. See this? This is a small smooth area there. So the smooth area may be a large area or it may be a small area. Why there is a smooth area on the bone? The large smooth areas which are seen at the ends of the bone, yesterday I also said that they come in contact with the upper bone or the lower bone, and here it forms a joint. So this smooth area which comes in contact, they are said to be articular area. So when you will see the smooth area, it is. And in living condition, we have learned yesterday that these smooth areas, they are covered by the articular cartilage or the hyaline cartilage, as in the lower end also, in the upper end also, in the femur. This is the large area, articular area. So smooth area may be. While the small smooth area which we have just seen here, see this is small smooth area, okay, which is seen here in a vertebra, they are said to be the facet, okay. So a smaller smooth area which comes in contact with the other bone and form a joint, especially the synovial joint, they are the facet. So either it is a facet which is a small smooth area covered by hyaline cartilage or articular cartilage. Similarly, the large articular area also covered by the hyaline or the articular. They are responsible for formation of a very smooth area, because joint movements are taking place and it should be smooth. But then there are areas which are also smooth in the shaft. For example, see here, this is a smooth area of the bone tibia on its lateral surface. This is on posterior surface, is also the smooth area. And this smooth area is not as smooth as that of the articular, but still it is smooth. And this is due to the attachment of the muscle, origin of the muscle fiber. Skeletal muscle fibers are attached. In some of the bone, then the area which is just under the cover of the skin, or that is the subcutaneous area. For example, this is the tibia, and just you touch your tibia on the medial side of your leg, and then you will see that the bone is found just beneath the skin on the medial side, okay, towards the median plane. Okay, this smooth area of the bone which is also beneath the skin, it will also be smooth because there is no attachment. There is no attachment onto this area. It lies just beneath. So smooth areas on a bone, they are called as articular area. They are smaller or called as facet. Then there may be the area for attachment of the muscles, skeletal muscle, large areas, they are also smooth, and then those areas of the bone which are directly under cover of the skin, they are also smooth, and they are subcutaneous areas. Okay, they are. So this is the first categories of the bony markings on a bone, okay, which is because of the smooth area. Let us come to the second category of the bone markings on a dry bone, which are due to the surface elevation. Projection, surface, from the surface there are a lot of bony projection will be seen, and these are given different names. Don't be afraid, you will understand it gradually, okay? So in the first time you will see that there are so many, and you will not be able to remember them. It's not like that. Gradually you will learn it, okay? So don't get afraid of this. There may be a surface elevation which is away, on the surface of the bone which is elevated. It is called as the crest, okay? This is called as the crest. For example, if I show you the crest, it will be a crest here onto a crest is an elongated projection. A crest is an elongated. This is called as iliac crest because this bone is a hip bone and this part is the ilium, hence it is called as the iliac crest, okay? There will be another structure which is called as the pubic crest. This elevation, a small elevation here, this is called as the pubic crest. So this is a large elevation. This will be called as the crest. Then there will be line, and this line are just a very short long elevation, okay? See here, Can you see this line here? A sharp elevation here is there. Okay, these are the supracondylar line because they are above, and another elevation has this type of the line you will see. They are the supracondylar line. Or you can also see the lines which is seen here. You see this is the back of the head, the skull bone, and you are seeing here the line. Okay, just I will mark with the chalk so that you can see. These are the lines. The highest nuchal line it is called as, and the superior nuchal line. So the lines are also there, and these are because of the attachment of the structures, muscle aponeurosis. Okay. So there will be line also, and then there will be the lip. Lip will be there. Lip means a raised, elevated line. Okay, it is also the line, but it is just a minute. It is a raised, elevated line which will be called as the lip. Just it's not here anyway. Okay, this is called as the lip. Lip you can also understand with this example. Okay, this was the crest, and crest has an inner lip and the outer lip is here. The margin of the crest which is broad, there will be the two margin. Okay. Similarly, in humerus you will also get the lip of the bicipital groove or intertubercular sulcus. That will be the lip is nothing but elevated line. Okay, elevated line, because these are the surface elevation. Then we come to the projection which is called as spine, and spine is best seen any bony projection that will be called as the spine. For example, this is a vertebra and this is the posterior bony projection which will be pointed or will have a tubercle. This kind of the elongated projection is called as spine or spinous process, and this will be more so in some of the thoracic vertebrae. That is the process I will just show you if it is there. Okay, they are called as the spine. It is called as spine. Okay. Spine means a pointed bony projection, long projection. Carnua is also a bony projection which that is seen in the bone called as the hide bone. It is a bone in the neck, and it has a greater and lesser, which are bony projection from the end of the bone. They are called as carnua, just like a spine. Okay. Then there will be a bony projection, surface elevation, which will be called as the styloid process. Okay, see here, this is the ulna bone, okay, medial bone of the forearm, and near the lower end of this, there is this bony projection going on. This bony projection, this is said to be a styloid process. There will be the styloid process in this skull. Okay, it is not broken here, it is here. You can see this bony projection. Can you see this bony projection here? Like a spine here, and okay, the long spine, and this is called as styloid process. Okay, so a projection of the bone, pointed projection, this is called. There is not much difference from one projection to the other projection. Rather, they are sometimes very confusing, but gradually you will learn to, recognizing them. You will gradually learn. So this is called as the styloid process. Okay, see this styloid process in the this ulna, this bony projection, and this bony projection like this. These are the styloid process. Then comes to the condyle. Condyle is a large bony rounded mass, almost rounded, not exactly rounded. See this bony mass. See these two. One is towards the head. This is the medial condyle of the lower end of the femur, and this is the lateral condyle. So they are large bony masses. See this bony mass here? See this big? It is the condyle. Okay? This is called as the condyle, which are usually seen. And then just this large bony masses, there will be another structure here. See this structure here? This this structure here, this was the large mass condyle, and on the top of that there is another elevation or bony projection is here, and this is called as the epicondyle. Okay, so a projection which is sitting on the condyle will be called as epicondyle. So there is a large mass condyle and a bony projection, that is called as the epicondyle. It will be called as the epicondyle here. Okay, then protuberance, and protuberance is also a projection because all these are elevations and this is not that big, and this is the, here for example on the back of the head here at the junction of the neck, this bony projection is called as the protuberance, external occipital protuberance. This is known as external occipital protuberance. So this is a projection which is a bony projection. This is protuberance. Any other projection which is not that very prominent will be called as protuberance. Then malionus. Similar to the condyle, there will be a smaller bony projection which is called as malionus. Again, this is the tibia. At the lower end of the tibia, you are seeing this bony projection here which is hanging by the side of the lower end, and this is called as malleolus. Okay, same malleolus will be seen also into the fibula. This is the lower end of the fibula, and a similar projection is pointing or hanging from the lower end, and this is also called as malleolus. You can feel near the ankle in tibia this bony projection, as well as on the lateral side in fibula. They will be called as the medial in tibia and lateral in fibula. So medial and lateral, okay, malleolus, they are called as the malleolus. Then spinous process, okay, spinous process I have just similar to that of the spine. There will be in the vertebrae there will be a long process, that will be the spinous process, okay. Then trochanter, and trochanter is a large mass of the irregular mass of the bone, okay. The greater and lesser trochanter of the upper end of the femur. See this upper end, this bony mass is better seen here in this case. This large bony mass here, yes. This large bony mass, can you see this large irregular bony mass here? This is called as the trochanter, and it is the greater trochanter. It is called as the greater. Similarly, there is another bony mass which is nipple-like here, okay, projection, and this is called as lesser trochanter. So there will be an irregular bony projection or surface elevation from the surface of the bone which forms a prominent marking. They will be called as the trochanter, greater or lesser. Then tuberosity, okay, tuberosity. And tuberosity is a large bony projection, not as large as trochanter, but still it is a bony projection. And this bony projection here, irregular in shape, this is a hip bone. This is a hip bone, and from the ischium of the hip bone, this is the ilium, this is ischium, and this is pubis. And from the ischium of hip bone, this large bony irregular projection here is called as tuberosity. It is known as tuberosity. While a small bony projection, as it is seen here from pubic bone, this is called as tubercle. So just there is not much difference between this bony projection, rather they are confusing sometimes. Tuberosity is this large mass of the projection of bone, while here this is called as tubercle, a small tubercle. Okay, so this is the pubic tubercle is here. So that in the case of the humerus, if I have the humerus here, I don't think I have the humerus. I don't have. There will be the tubercles in the case of the humerus. So these were many surface elevations. They were projection, irregular, spine tail with the breadth or with the very sharp margins. They are different kind of projection. And why these many projections are seen? As I have already told you, these projections are because of the soft tissue attachment onto the bone. Tendon will cause a very big projection. Okay, the joint formation will form the condyles. Okay, attachment of the muscles will be smooth surfaces and projection with the spine, tubercle. These are mostly, and tuberosity, they are mostly because of the attachment of the strong muscles or their tendons. So they are in relation to that of the, I mean to say, bony elevations. Okay, I mean the attachment of the various soft tissue or relation of the soft tissue. Let us come to the third type of the bony features or markings, and this is surface depression. In the surface depression, where then the markings or the feature is depressed from the normal surface of the bone. Okay, and these depressions which is on the deep to this normal surface, say for example there is a groove here. So this will be groove, or it is called as the sulcus. Sulcus. Okay, groove or sulcus will be seen. Okay, and that will be a depression, rather in case of not an elevation, but it is depression which is called as the sulcus. It is I am not having the humerus, otherwise I would have shown you the bicipital groove. Okay, and then the sulcus. Sulcus is a linear or a long tunnel, I mean say the gutter-like space, okay, which has a depression. Sulcus are the groove, okay, and this is produced because of the tendon, mostly the presence of the tendon which is passing through this depression, elongated depression, okay. Then there should be a notch. Notch is an acute curve or the bony structure. See this is a notch here. This is a notch here. This is also a notch here. This is notch, this is notch. This is called as greater sciatic notch, and this is called as the lesser sciatic notch. There will be at the upper border of the scapula, you can see this notch. This is also a notch where there is a acute depression is there on the border of the bone. That will be called as the notch. Then come to the another depression called as the fossa, and fossa is better seen. Let me show you the fossa, and that is the shallow fossa is an example of the iliac fossa. Can you see this area of the ilium? This is showing concavity, okay, and this is called as the iliac fossa. That is a large fossa. Just a minute, I will bring a humerus and let me continue. Now, this is the humerus, and the lower end of the humerus is here. It is the lower end of the humerus, and you can see this deep depression. Okay, surface depression is here. See this depression where I am putting my finger, and this is called as olecranon fossa. Olecranon. So this is type of the fossa is here, and I was talking you the groove or the sulcus. This is where I am putting my finger, tip of the finger. This is the groove or the sulcus at the upper end of the humerus. So that is called as the intertubercular sulcus, because these are the two tubercles, okay, greater and lesser tubercle, and in between these two is intertubercular sulcus. Let's come to the foramina, and foramina means there are various openings or foraminas through which the structure can pass, okay, that I will show you the foraminas. See, there will be many which will be teaching you a lot when you will come to the base of the skull. So there may be various foramina through which the nerves and vessel may be passing. So they are the foramina, and a foramina with a length. A foramina with a length is called as the condyle. Okay, the foramina with a length is called as condyle. Condyle, not condyle, canal. Sorry, not condyle, but canal. Canal. a tunnel through which the blood vessel, nerve, vein, artery, okay, they may passing, but it is not a foramina, but it has a length, hence it is called as canal. It is called as canal. So what you learn today are the bony feature. I know that you must be utterly confused, but don't worry, gradually you will learn it. Okay, sit with the bones and see, or with the help of diagram in initial stages, and try to follow this. Okay, three categories of bony markings: smooth area, surface elevation, and the surface depression. Without learning this, you will not be able to understand the general features of the bone. Thank you very much for watching this video.